I'm Ruth Shepherd. I work for Thames Reach at Robertson Street Hostel. One of the main challenges we're seeing across London, which is also reflected at Robertson Street, is the number of referrals we're receiving. So that's the number of people that are rough sleeping. And we receive referrals directly from the outreach teams who work with people on the streets. Another trend that we're seeing is an increase in the complexity of needs that these people have. So not only are there more people, but the level of need they have is high. This could be due to really poor physical health. This could be due to poor mental health, which means they require very specialist support and funding in order to get the help that they need. So Robertson Street, I think, really contributes because we are able as a team to offer that really high quality support to people who have previously been rough sleeping by giving accommodation and giving people the opportunity to start to rebuild their lives and to access the support they haven't received previously. We have a team of support workers, we have an in-house psychologist, we work very closely with our local GP, with our local drugs and alcohol service. So all of those teams come together to provide kind of wraparound support for people that then allows them to rebuild their lives and to re-enter the community. There are challenges to ending rough sleeping, but an impact story that really stands out for me is a client who had actually lived here for many, many, many years. And over the years, there have been numerous attempts to try and support him to move to the right kind of accommodation. This was particularly tricky. So he had a diagnosis of dementia and had really complex physical health needs. So trying to find somewhere that he could live that was safe, but also meant that he could live kind of a fulfilling, stimulating life with those different kind of contrasting needs. However, in a relatively short period of time, we were able to get all of the proper assessments completed, all of the proper diagnoses done, and he was able to move into his own flat, so where he has his own space, but he has kind of wraparound support from social services and other community services. And from going from living in a hostel for, it was coming on to 8 years, to then move into his own accommodation with support, felt like a real success story. Ending rough sleeping is a real challenge, but I do think this is possible. It's only possible, however, if we take a really joined-up approach. It can't be done by Thames Reach alone, it can't be done by London alone. It needs to be done in conjunction with lots of different people, be that local charities, be that politicians, be that the general public. But if we're able to do this, we can end rough sleeping.